Mr. Geraghty, welcome.
Thank you. Happy to be here.
Healthcare in Florida, that was the subject of a breakout panel today at the summit. You are the CEO of Florida Blue, a tremendous position of responsibility. What are some of the most important concerns you have about healthcare in Florida right now and moving into the future?
Well, first of all, I take that responsibility of being the CEO very seriously, and our company takes our position in the health and healthcare equation extremely seriously. We're looking at a situation in our state where we've got a growing obesity level, we've got a very high smoking level, we have a large senior population, and so Florida is really a microcosm of the challenges that the United States has in healthcare. So we believe that we must focus on health, wellness, prevention on the front end of the process. And on the back end of the process, where we're talking about care, we really need to have care that's focused on high quality and efficiency. And so we need to change the reimbursement system from the fee-for-service where it's been, which really encourages volume, to a value-based system that really emphasizes quality outcomes and doing it well and efficiently.
You talked there about the front end of the system and the back end, but you talked about reimbursement. Is that the major strategy to change behavior, is through the reimbursement system?
I think there are a number of strategies, but the reimbursement model is clearly one of them. We've grown up with a lot of people that are sort of dependent on the system to tell them what they need. And we're moving in a variety of ways. The system needs to have the right incentive in it, but then individuals need to have the right incentives for them. Meaning we've got to make health and wellness easier for people to obtain. We need to have the access to information. People need to be informed about what their choices are, even on the economic side. So if you're going for a service, you want to be able to see, what will it cost me across a variety of choices that I have in my area, and who does the best job. And so we're making more and more of that information available to our consumer.
Will this change the experience of most people with their healthcare providers? And that's an educational process, right? Not only for the patients, but for the providers.
I think it's an educational process for everybody, because if you're going to address this issue, people have to be more engaged, right? And how do we get people engaged? People have to care about their health. They need to be able to see the impact that living a healthy life has on their later years in life. They need to be able to see that if they live a healthy life and they have better numbers because of that better lifestyle, that they can get a break financially, because people do gravitate their behavior to what's incented. And so we believe in all of those kinds of drivers in the system to get the system to be better.
The new federal health care law is going to change a lot all over America and in Florida in terms of incentives and every aspect of health care. How is your company preparing for that?
We've done an awful lot of things to be ready for the Affordable Care Act to be implemented. First of all, I should say, it's the law of the land, so we don't spend a lot of time thinking about, is it going away? We spend our time thinking about, how are we going to comply and what can we do well inside of the new laws as they exist. So one of the things we did is we created patient-centered medical homes. Big phrase, but what it means is we went to primary care doctors and said, we're going to pay you to keep your office open longer. We're going to pay you for taking care of patients for the longer continuum of their care, not just when they're in your office, but making sure that we don't have utilization of the emergency room when you could see somebody in your office. What that meant was we pay primary care doctors more than we used to pay them. And what we found in a year and a half of this experiment is that we're having less overall cost to healthcare when we pay the primaries more to do more service. So that's been a very good experiment for us. The other thing we've done is we've created 8 accountable care organization arrangements around the state. Now, when some people use that term, they think it means the provider of care dealing directly with the government. We have a different model, and I'm happy to say that hospitals around the state have responded to the model, and that is we're a partner in that accountable care organization. We have a lot of data, we have a lot of capability in high transactions, we have a lot of capability in interfacing with members. Hospitals are not built that way. So the partnership is the hospital and doctors doing what they do well, and Florida Blue doing what it does well.
Well, in the exchange that the federal government is setting up, where does Florida Blue fit into that?
So we're the only company in the state of Florida that's offered in every county in the state, and that's really a part of our commitment. We're the local company, we're the hometown plan. So there are others that compete in the health insurance marketplace who are offered in only a piece of the state, and then there's others that are sitting out the exchange for the first year. They want to see what happens. That's a nice place to be in if you have that luxury. That's not our luxury. We're committed to Floridians. We're committed to the state. So we're in every county. We're going to be offered all over the place. We're going to have a variety of options available to our customers, and we are committed to being able to serve everyone who's looking for health care.
One of the challenges or goals of the day one panels was to identify disruptive trends in various policy areas. In healthcare, what do you see as disruptive trends, maybe long term, that if we don't get a handle on these trends in healthcare in Florida, there's going to be serious trouble ahead?
Yeah, well, there are two parts to the question you asked from the way I hear it. One is there's a disruptive trend of obesity that has to be taken apart, and we have to look at what drives it. And I think that's a collaboration of all the stakeholders. And when we talk about stakeholders with obesity, it's not just the insurance company, it's not just the doctor or the hospital. We're talking about the schools, we're talking about the food industry, all of the players that are part of that equation.
You think
need
it's
to
that
come
profound?
Together. I think it's that profound, and I think it will crush economically any of the other improvements or changes that happen. So that's one issue. The other side of talking about disruptive innovation is really how do you do things differently? I think we're going to be looking at how do we make healthcare much more convenient. And so one of the trends we will see is that people will be able to have their physician visit on their smartphone. And so it will be convenient to the customer. Think about a typical scenario today. A child in a family has an ear infection twice a year, every year. The mom knows exactly what needs to be done, but she's got to trudge the kid to the physician's office, miss school, be there, go to the pharmacy, wait, get the prescription, when everybody knew what needed to be done. In a new world, you go online, you talk to the physician for a couple of minutes, video to video, you tell the doc what's going on, he looks into the record, sees exactly what needs to be done here, orders the prescription, and on the way to school, you pick it up and give the first dose of medication. That's a whole different world, and it actually fits the way we live. That's where we're going, to convenience. That's a system built around the patient, and with all due respect to my doctor friends, and they will tell you this, the previous system was built around the doctor and the hospital, and the new system is going to be built around the consumer.
From educators, I've been hearing about online education. You're talking about online healthcare.
Absolutely.
Finally, tomorrow there'll be discussion about big, hairy, audacious goals, something that's like when Kennedy said we're going to the moon in 10 years. That turns everything around. Is there anything in your mind for healthcare that stands out that we need to really look at and say we're going to do this and it's going to turn everything around?
Absolutely. I think the big target is to be the healthiest state in the nation. Because if we say we're going to commit ourselves to be the healthiest state in the nation, that will create all kinds of activity underneath that goal. We'll say to ourselves, we're not going to let this obesity epidemic take off. We're going to dig in and fight the root causes. We're going to look at nutrition in our schools. We're going to look at the outreach in our workplaces to make sure we've got walk at work programs going on, that we've looked at the cafeteria and figured out how to make the best selections, the ones we subsidize. We're going to try and make the right choices easy for people to access. And I think there'll be a ton of activity there. And some of the best ideas, we don't know what they are. They're going to come from the grassroots. That's the beauty of that movement. So if we put that banner out there for our state, I think people from all over the state will be able to contribute to how we can get to that achievement.
Thank you for joining us.
My pleasure.